We are starting the session, and the first topic is by Dr. Mahesh on intricacies of consent and documentation.
Good afternoon. I'm sure you are not going to sleep this hour because it is like a nightmare. Whatever we are going to tell you and scare you, all these things are going to be a nightmare. I don't think anybody will sleep. So let us start with the documentation and consent. These are the two pillars or two things that can save you from any litigation. In fact, medical practitioner is liable by criminal, civil, lot of laws, and Medical Council of India, now NMC, has put down regulations which says there are some duties of the doctor to the patient, and one of them is maintenance of medical records. So that is the one of the duties of physician or caregiver. So, and this is it's an essential element in legal system because that is the one that is going to save you. And the serial documentation also helps in research and giving high quality care also. So let us see one case like this was State Consumer Redressal Forum versus Baldev Kishan, end of ophthalmitis. Okay, so the case went against the doctor just because the vision was not mentioned in the initial records, just because of that thing. So it is just shows the importance of documenting each and every. Another case was there where the doctor argued in the court patient was an alcoholic, and because of that he fell down and had an injury, and but the alcoholism was not recorded in the document, so court will not consider these things. So this is the importance of documentation. So make sure that vision is recorded and all the findings are recorded properly. So there is something called the fact criteria, FACT. The document should be factual, only information that you see, all important information, and in good language. Actually, don't write the code language which only you will understand, because many of them are not approved officially. It should be accurate and precise. It should be complete. Complete means everything, including if the patient is referred to someone, that also has to be noted. If the patient is refusing to take treatment, that also has to be noted. So accurate, complete, and timely. You have to enter the date and time. And in this case, I think electronic medical records has an advantage because we don't have to write time. It is already there when you entered the last time. So that is one advantage where you don't have. And confidentiality is another important aspect of medical records. The data in the medical records belongs to the patient, and you cannot divulge it anywhere without his permission. Remember, never attempt alterations. That means now the situation is bad in the sense everyone is having a very nice smartphone. You make something like a consent. Today somebody was discussing consent. We will fill. Sometimes we will not fill the surgery. We will not fill the doctor, and patient will sign. He will take a photo. When I signed, this was the situation. He has tampered with the. So this mobile phone is a deadly instrument with which anybody can document what they are signing, and later you cannot alter. So that is important. Never make alterations. Who owns the medical records? The caregiver and the hospital owns the medical records, but the data is owned by the patient. So release of medical record. If the patient asks for a medical records or a report, you have to release it within 72 hours, and it is a right of the patient. Within 72 hours means 3 days. So without any charge. So this is also mentioned by Supreme Court of India. So this you have to give a report. That is very important. Up to how many years you have to keep the records is another issue. Usually we have to keep the records up to 5 years. In roughly, there are not strict guidelines. IP, OP, there are some differences, but to remember, at least keep it for 5 years. So that is the take-home message. So electronic medical records have come in the last probably 5-6 years or 6-7 years, and it is very good, in fact, because court accepts it as a normal records. There is enough and more judgments from the court which says that electronic records are okay. Why? Because a forensic examination can easily find out when you have tampered the medical records. It is easy. You cannot do any change after a particular night, 12 o'clock or something like that. So it has reduced cost. It has helped in research, ease in maintaining lifespan of health. Your records will not be eaten by termites. Safety, audit, faster. So everything. EMR is the way to go in future. There is no doubt. Then as for me, I also feel EMR is better because automatically date and time comes. My dirty handwriting, not even I can read. So, and there are some steps we cannot omit, like diagnosis. After diagnosis only you can sign out after in a EMR. So that is the importance of EMR. Accessibility, very easy. Research, it helps. So EMR is definitely the thing to go. Now, second part of the talk is consent. Medical litigations are mainly due to lack of consent. In fact, one study showed that 50% of medical litigations are due to poor consent taken or communicated with the patient. Patient will say, I was not told, or I didn't read. So, everything, most of the cases are due to the bad consent or improperly taken consent. So, that is the importance of consent. So, consent has, it's a legal term, voluntary authorization by patient or a research subject who knows what is going to happen, the sequences, consequences, and what if it is not done, all these things. So informed consent is a legal term, and it is actually something like a constitutional right, but not a constitutional right as such. Article 21 says patient has the legal right of autonomy and self-determination as per the Article 21. He can consent when to treat himself or not to do anything. So it is a right, almost a constitutional right, even though it is mentioned in the Article 21. So consent has been there for the past more than 100 years, and way back this judgment of Justice Benjamin Cardoso is the key word for consent. Every human being of adult years and sound mind has the right to determine what shall be done with his own her own body. And a surgeon who performs an operation without the patient's consent commits an assault. So this is the gist of consent. So there are different types of consent. Implied consent. A patient is coming to you for dilatation. You don't have to get a signed. You tell that this will cause blurring for 3 or 4 hours, and then put the dilating drops. You can't drive back. So that is called implied consent. Examination in slit lamp, implied consent. You just keep this thing, or even for taking applanation tonometry, implied consent. But there is something called expressed consent. It can be oral or written, usually written. Even minor examinations like INC or fluorescein angiography or procedures or any therapeutic procedures, you need a written consent. Written consent should be obtained in all surgical operations and invasive investigative procedures. So informed consent, there are different types. One is called informed consent. In patient's own language about the whole thing, nature of the illness, treatment possibilities, outcome, what he can expect, what are the complications, what are complications if you don't do the thing, everything. In UK, what they give is valid and real consent. It is voluntarily given by a competent patient with minimum adequate level of information. That means too much. If you do cataract surgery, you need not mention sympathetic ophthalmia, because that is a very, 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 very remote possibility. If the complication rate is 1% or less, probably you may or may not put it in the consent. That is UK consent, that which we are also almost similarly following. But in US, it is entirely different story. It is like a booklet. The whole thing will be there. Alternative, risk associated with treatment, with risk associated with no treatment, everything. That is there. One booklet will be there for each. So they will have to read everything and then sign. That is why the legal litigations in US are much more because of this. Situation in India, it is somewhere between UK and US. Indian Contract Act is the basic act which has some gray area in children between 12 and 18 years. But ultimately, above 18 only, you can give a consent. And in India, there is another thing called doctor-patient relationship is governed more by trust. This was the situation many years back. Now it is changing. We are also becoming like UK or US. So this is just for, we are not gods. So that trust element is reducing, and now we are all professionals giving treatment. So a doctor can do a procedure without consent in an emergency, like an accident, suturing, or if when the victim is incapable of understanding the nature of the treatment. This freedom is given by Section 92 of IPC. I am not telling BNC because we are not read BNC now. It is all still we are going on with IPC because we are just learning that. This case, I keep on telling every audience, Samira Kohli versus Prabha Manchanda. The doctor went for a EUA, examination under anesthesia, and found that there was a ovarian tumor or something. He just removed the ovarian tumor and uterus also. Just called the mother who was standing outside and then removed that. When the patient came out, 40-year-old, she knew that her uterus is gone, she can't have a child, then they sued. So this was the classic case of lack of consent in in that case, Supreme Court has given very, very clear guidelines regarding consent, given by person, expressed written consent before the procedure, given in the presence of two witnesses, preferably not doctor and patient, and freely, voluntarily, directly signed by doctor. Actually, I had 2 years back, I had a questionnaire. Our own doctors, KSOS doctors, 25% of doctors, we don't sign the consent. I don't know who is signing. The reply, I got a reply from around 300 doctors from KSOS. They say 25% don't sign so I don't know. Let God only save them. Blanket consent is something that we should not take. Camp and all. Just write something, one blank, you get signed. When the patient signs, no, he will take a photo. That is enough. So blanket consent has no. There are some conditions where consent is not required, like notifiable disease, immigrants, armed forces, etc., etc. Don't worry about that. These are all things for completion. And video consent is useful. It is accepted by court also, where there is an evidence. Only thing they may take it for a forensic. Where there any tampering is there, they will check it probably. So this is our study I was mentioning. So what is an ideal consent? There are some gray area I told you in minor consents who should sign, but preferably both parents, and if the child is between 12 and 18, you can ask the child also to sign. Content of the consent, I said it should have, yeah, just 2 seconds. It should have all the serious rare complications and all common, not very serious complications. Like if you do cataract surgery, small lens power may remain, or that sort of foreign bodies, small things you may have to mention, which is common, and rare things which are dangerous, like endophthalmitis also, you have to mention very small percentage. So this is what the concern should have. Like we in retina, we make the patient write this. This patient is currently has given litigation against me. So I have made the patient's bystander write everything, write it signed and with this thing. So already one vigilance inquiry said I have done everything correctly. And in that printed consent is valid only if you write in the below, I have gone through the consent and understood that patient's handwriting or bystander's handwriting, it should be written. So we are, as KSOS President's Initiative, we are trying to bring out a booklet of consent in Malayalam in next 1 year. Dr. Reena and everyone has promised, Ashok and all has promised probably by next year we will get this thing. Thank you for the kind attention.